Hello, everyone, and welcome to our webinar titled Epilepsy, Depression, and Anxiety. What do we know? I'm Dr. Mary Pat McAndrews. I'm a neuropsychologist at the Krembil Research Institute of the University Health Network in Toronto, Ontario. I'm also the co-director of EpLink, an epilepsy research program of the Ontario Brain Institute, known as OBI. OBI is a provincially funded not-for-profit working to accelerate discovery and innovation, benefiting patients and the healthcare economy. This webinar was organized by EpLink, OBI, and CAN-BIND, which is OBI's depression research program. The aim of this event is to provide an overview of what we know about why mood disorders, specifically depression and anxiety, are so common in people with epilepsy, and what treatments are currently available to help improve and manage symptoms. Many members of EpLink, CAN-BIND, and OBI, including myself, reside on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. Our moderator for today's webinar will be Heather Sherman, Manager of Communications for the Krembil Research Institute. Heather is an award-winning television producer and writer, having worked most recently for Discovery Canada's Daily Planet. She's also co-producer and host of Krembil's Your Complex Brain podcast, covering the latest in research in brain diseases and disorders through the stories of patients and their healthcare teams. Heather, over to you.
Thank you so much for that kind introduction, Mary Pat. And as Mary Pat mentioned, I'm going to be your moderator for today. My name's Heather Sherman, and I just want to thank everybody for being with us. Today's conversation about the link between epilepsy, depression, and anxiety. We have an excellent group of speakers who are going to present, and then there's going to be a question and answer session following the presentations. So you can also submit questions as we go, and there's a few different ways that you can do that. Number one, you can use the chat function on the right-hand side of your screen. You can direct message our Twitter account using the handle @OntarioBrain, or you can email us at communications@braininstitute.ca. So I'm very excited to now introduce our first speaker, Verma Benjamin. Verma has lived experience with epilepsy, depression, and anxiety following brain surgery for the removal of a benign tumor. Verma is a client of Epilepsy Toronto, where she's accessed individual counseling through the Uplift Cognitive Behavioral Therapy program, as well as art therapy services. And we're very grateful that Verma is here today to share a bit of her personal story with us. Verma?
Thank you, Heather. Thank you so much, and welcome to everyone who's here. I'll begin at the beginning. So following the removal of my olfactory groove meningioma, which involved brain surgery, 8.5 hours, I was told that my first seizure occurred post-op in the ICU due to a bleed on my brain. I had no idea about this. Then I was started on anti-seizure meds. During the taper, I then experienced what's known as a tonic-clonic seizure. For persons not familiar with that, it's like when you shake all over, the things that they show you on TV. And that actually was status for me, which meant that I went into seizure and could not stop seizing. And my partner at the time, gratefully, she called 911, and I was administered midazolam and taken to a hospital and stayed overnight. Then my meds were restarted. Those particular meds didn't work quite well for me. My anxiety increased, my mood was not the most friendly. And then I was also put on sertraline or Zoloft to deal with the anxiety and somewhat with the depression. Now those depressive moods increased dramatically in dealing with epilepsy. It was difficult to actually accept that I was epileptic. I figured, oh, I had 2 seizures. And fortunately, my partner at the time, and great friend, put me in contact with Epilepsy Toronto, where I was able, through counseling and one-on-one therapy, to accept the diagnosis, and also to reach further services, to connect with other services. Sorry, my brain kind of times out like a computer. So the journey has been interesting. The depressive moods, a lot of the times the depression comes from me wishing that my life was different, and also with each epileptic episode, I can feel the setback. A tonic-clonic seizure kind of feels like, if you know baseball, like Aaron Judd hitting a home run. It sets me back mentally, cognitively, and physically, which in turn makes me feel worse. I mean, there are days when I lie in the bed and cry. With the increase in anxiety, I tend to pace back and forth, which doesn't feel normal, even though I'm told to embrace the new normal. But things that have helped are the Uplift program. I've recently completed art therapy, and also through the Uplift program, I've met peers, and we have informal peer supports. We email each other, we stay in contact with each other, and that has really helped, because prior to this, I've only known of one other person who had epilepsy. And so in a way, this normalizes it for me and helps with the depression and anxiety. And I'm very grateful also for my neurology team, who was able to tweak my meds. I'm now on a new med. And then following the last major epileptic episode, another med was added in. So I'm on a suite of meds at the moment, and it seems to be holding, fingers crossed. And that's it. You know, there are varying things that happen as a result of epilepsy. Not being able to drive and being really dependent, and also being in a part of my life where I really have to ask for and accept help. And in closing, I'd just like to say, if there's anyone out there who's experiencing epilepsy, reach out. Allow your friends and family to help you. And if you're a caregiver, there are resources available as well. Thank you so much. Over to you, Heather.
Thank you so much, Verma. Thank you for sharing your story with us today. And also, we're so appreciative of your willingness to speak about your struggle living with epilepsy, and a little bit about your day-to-day experience of managing depression and anxiety. So thank you so much. Our next speaker is Dr. Elaine Kyriakopoulos. Elaine is a neurologist and an assistant professor of neurology at the Geisel School of Medicine at Dartmouth College in New Hampshire. She's also the director of the Hopscotch Institute for Cognitive Health and Well-Being at the Dartmouth Hitchcock Epilepsy Center. Dr. Kyriakopoulos' research targets improving access to epilepsy care and self-management resources, as well as addressing the social determinants of health in diverse and vulnerable patient populations. Elaine, over to you.
Thanks so much, Heather. And thank you, Verma, for sharing your story. Your resilience is remarkable, and your words have so much meaning, I know, for anyone who's listening today, who has epilepsy and who may be struggling with depression and anxiety. So thank you for that kind introduction, Heather, and thank you all for the opportunity to be here with you today. If I could get the next slide, please. Great. And so listed here are my disclosures for today's presentation, and we'll move right on to the next slide. All right, we're going to start just a little bit about talking about comorbidities in epilepsy. And an important point not to lose sight of in caring for individuals impacted by epilepsy is depicted here on this image of an iceberg. And that is that for many people, seizures, which are recognized as a visible symptom, represents really only the tip of the iceberg when it comes to epilepsy. comorbidities and psychosocial challenges often present metaphorically below the surface. And today we're going to be talking about two of those, depression and anxiety. Next slide, please. So what do we know about mental illness in epilepsy? We know that mental illness is disproportionately common in people with epilepsy. A recent systematic literature review done in 2021 demonstrated a relatively high prevalence of mental health comorbidities in people with epilepsy. Mood and anxiety disorders are the most common comorbidities, with prevalence rates of 35% and roughly 26% respectively, while psychotic spectrum conditions such as schizophrenia and bipolar disorder are less prevalent. Now, it's important to note that the prevalence of comorbidities can vary by epilepsy type and also depending on a person's responsiveness to treatment. Next slide, please. Shown here on this slide is a population-based study which was done in Canada that shares the lifetime prevalence of mental health disorders in people with epilepsy compared to those without. Now, as a population-based study, this is representative of what happens to everybody in the community and is not and as you can prevalence of
apologies,
cut
Elaine, your
out?
audio just cut out for a moment, so maybe you can just review the slide that you're on.
Go back to that slide. Sure, exactly. Okay, I'm sorry about that. So shown here is a population-based study. So I'll start right back at the beginning, which was done in Canada, and it shares the lifetime prevalence of mental health disorders in people with epilepsy compared to controls. Now, because it's a population-based study, it's representative of what happens to everyone in the community and not just reflective of people who are cared for at an epilepsy center. And what you can see when they looked at the prevalence of any mental health disorder in the past 12 months, what they found was the prevalence was significantly higher in people with epilepsy than those without, more than twofold. And they also looked at the prevalence of suicidal ideation and found that it was nearly twice as high for people with epilepsy as compared to individuals with no history of epilepsy. Next slide, please. Now, one of the things that we often talk about when we think about epilepsy and mental health is the bidirectional relationship that exists between epilepsy and depression. And it's fairly well established. In fact, we can go back 26 centuries when Hippocrates expressed that melancholics ordinarily become epileptics and epileptics melancholics. And what this means is if you have symptoms of depression, you're more likely to develop epilepsy. And if you have epilepsy, you're more likely to develop depression. And 26 centuries later, this observation has been confirmed in several studies. Next slide, please. So what are we talking about when we use the word depression? Let's just define this a little bit. So depression, we know, is a common and serious medical problem. And a number of factors can play into why someone may be experiencing depression. They can be genetic or environmental or biologic, or there may be psychological factors. It is the most common psychiatric comorbidity in people with epilepsy. When we talk about this, we're talking about more than just a low mood, which all of us experience. Depression really affects how someone feels and how they act. Both mental and physical health can be impacted. And for many people, it can make it difficult to function at home and work. And, Verna shared that with us in her description of how things have been for her from day to day at certain times. It can vary from mild to severe. And one thing I want to highlight here for people with epilepsy and any providers who might be listening is depression is treatable. Just because someone has epilepsy does not preclude them from being treated for depression. And so it's important to keep that front and center. This is something that people can receive help for. Next slide, please. So why are people with epilepsy more likely to experience depression? Well, there's a number of reasons, and we'll talk about a few of them here. So we know that seizures can arise from regions of the brain that help to regulate our mood. We know that some people may experience depression directly related to seizure activity. We also know that a diagnosis of epilepsy can bring sudden changes in lifestyle and a feeling of loss of control. And then we also are aware that anti-seizure medicines can affect a person's mood. Important again to emphasize that if this is occurring, it requires a medical evaluation and treatment. And along with the medical aspects, and Verna emphasized this as well, is that social support is vital for people with epilepsy. Next slide, please. Some of the signs of depression, which are common, and you can see them listed here, really have a wide range for how someone may present with depression. So lack of sleep or too much sleep, isolating from others, losing interest in a personal appearance or hygiene, crying and anger, those are two symptoms that are at the forefront that often are recognized. Sometimes people have trouble with making decisions or express a feeling of worthlessness. So these are some of the signs of depression that we know can be exhibited. Next slide, please. Let's switch over and talk a little bit about anxiety. And we've all experienced anxiety. Certainly, if I had to hop on that roller coaster on the right, I would be very anxious. I don't know if I could get on, and I don't know if you could get me off once I was on. But occasional anxiety can be an expected part of life before a big event, or from something that needs to be done at work or school, or when you're trying something new. But the anxiety we're talking about here today is more than temporary worry or fear. It's a feeling that doesn't go away. It can get worse over time, and it can interfere with a person's daily activities. Symptoms of anxiety tend to worsen during times of stress, and there are several different types of anxiety disorders that a person might be diagnosed with. So it's important to get to the right level of care to make sure that a diagnosis is accurate. Again, emphasizing here in the red at the bottom of the slide is in a person with epilepsy, anxiety is treatable. And so people should be referred on for the help they need. Next slide, please. Why are people with epilepsy more likely to experience anxiety? Again, we know that the symptoms of anxiety can occur before, during, or even after a seizure. Anxiety can also be present between seizures. It might be related to the area of brain where a seizure originates, so it's seizure onset area. We know there can be side effects from anti-seizure medicines, the stress of an epilepsy diagnosis, and thinking about having to disclose one's epilepsy to others, be it family or friends or colleagues at work, can oftentimes make people feel anxious. Fear of having a seizure it is a big one for people with epilepsy. We all know that for many people, while about 2/3 of people respond well to epilepsy medications and have their seizures well controlled, there are a third who don't. And in those instances, life can be unpredictable, and the fear of having a seizure can be really difficult. We know, again, that this requires medical evaluation and treatment, as I've mentioned. And again, social support is going to be key to help people with epilepsy deal with their anxiety. Next slide, please. Here are some signs of anxiety listed here, and you can note some of them overlap with the signs for depression. But other things that we've included here specific to anxiety are feelings of nervousness or restlessness or worry, difficulty thinking, for some people sweating, again, sleep may be disrupted, headaches and body tension or muscle aches may come to the forefront. And again, irritability and anger, and an inability to make decisions. And that same expression of a feeling of worthlessness are also signs for anxiety. Next slide, please. So let's talk a little bit about treatment and support. So comprehensive treatment is something that needs to be considered for each person who's experiencing depression or anxiety. And that can be, a spectrum of things. So psychological treatment with referral to a psychiatrist or a psychologist, of course, is key. And pharmacotherapy. So treatment with medicine may come into play. And what I'll say is that this is very specific to individuals. So people can react very differently to the same antidepressant. For example, a particular drug may work better or not as well for one person than another. Or you might have more or fewer side effects from taking a specific antidepressant medication than someone else does. Generally, selective serotonin reuptake inhibitors, and you'll hear them called SSRIs, are the most commonly prescribed antidepressants, and they can certainly ease the symptoms of anywhere along the spectrum from moderate to severe depression. They are relatively safe and typically cause fewer side effects than other types of antidepressants do. And the way they work is they treat depression by increasing levels of serotonin in the brain. And serotonin is one of the chemical messengers or neurotransmitters that carries signals between brain cells. A second type are called serotonin and norepinephrine reuptake inhibitors, or SNRIs. And they're also a class of medication that are effective in treating depression. They ease depression by affecting chemical messengers, also neurotransmitters that are used to communicate between brain cells. And like most antidepressants, they work by ultimately affecting changes in brain chemistry and the communication between cells and circuitry that are known to regulate mood to help relieve depression. They block the reabsorption or the reuptake of both serotonin and norepinephrine neurotransmitters. We also know that treatment and support can also sometimes involve a change in anti-seizure medicine. If someone has had a side effect, mood-related, to a seizure medicine they're on, then a discussion, communication with their epilepsy provider is key to making sure that that's taken care of, perhaps with a medication change. Sometimes it's a dose change, but that's an individual one-on-one discussion. We also know that psychoeducation and evidence-based epilepsy self-management programs, as well as advocacy and support groups, can be very, very helpful when it comes to depression and anxiety. If I could get the next slide, please. Great. Thanks so much. I'm going to just briefly tell you about something called the Managing Epilepsy Well, or MU Network, which focuses on self-management. And the mission of the MU Network is to advance science related to epilepsy self-management by implementing and facilitating research in collaboration with both academic network and community stakeholders, and then sharing that. And these programs that I've listed here for you are programs that undergo a long process before becoming available to the public. They're carefully developed with input from people with epilepsy, from clinicians, and other experts on epilepsy. And they're tested to ensure that they're of the highest quality and have solid scientific evidence showing that they're effective in improving the health and well-being of people with epilepsy. And Verna mentioned she participated in the UPLIFT program. And that is a program that targets mental health, anxiety, and depression. The SMART program also targets mental health. And the Hopscotch program targets cognitive issues and mindfulness, which can sometimes lead to difficulties with mental health. So I encourage you to look into these programs. A number of them are offered at Canadian epilepsy serving organizations in Ontario and beyond. Next slide, please. I want to just take a minute to touch on pediatric epilepsy and comorbidities in kids. So how common are comorbidities in children? This slide reflects findings from a large study, and this is a patient registry which was done in Norway that looked at over 1 million children. And they followed the kids for over a 17-year period, and they compared comorbidities in kids with epilepsy, both complicated and uncomplicated epilepsy, with children in the general population. And they defined complicated epilepsies as epilepsy with additional neurologic or developmental disorders. And what they found when they looked at this list of comorbidities was that children with both complicated and uncomplicated epilepsy had a higher risk for comorbidities than kids without epilepsy, and that their findings were particularly marked with complicated epilepsy. Next slide, please. If we look at some of the symptoms present in children, depression symptoms can include sadness, withdrawal, low motivation, and irritability. And I'm just going to touch a bit on the irritability piece because I often think this gets missed. Irritability is actually thought to be related to depression, particularly as kids move into the teenage years. And it often gets missed or sort of attributed to normal teenage behavior, but it's an important warning sign. Now, anxiety, including more persistent worry that interferes with day-to-day activity, as well as more physical symptoms, that should raise flags if feelings of being overwhelmed are expressed, or a child is complaining more about things like headaches and stomach aches. That should be, factored in, and those signs should be pursued and discussed with the child's provider. Next slide, please. Important for diagnosis, so important is screening. The diagnoses for these conditions are often made through screening, and because of the known frequency of depression in epilepsy, this is often done at routine medical appointments. It can also be made based on self-reporting or collateral reporting from teachers or coaches about behavior at school, or concerns might be raised that come from a sibling or a peer. The key here is early referral to a mental health provider is so important. Next slide, please. Risk factors in general for developing depression and anxiety include low coping skills, low perceived social support, or low self-efficacy, which is the sense that a child or youth has that they don't have control over what happens. Next slide, please. Now, as we've discussed, we know that depression is higher in persons with epilepsy, and that the risk in children with epilepsy ranges somewhere between 16 and 26% based on clinical studies. Depression can often predate seizure onset, and development of depression is less related to epilepsy variables. And by epilepsy variables, we're referring to things like seizure severity or having multiple types of seizures. And it's more related to psychosocial factors, so social supports, coping skills, and genetic predisposition. Any family history of depression or other psychiatric disorder would put a child at increased risk. Next slide, please. Anxiety is also quite common, and studies have shown that between 16 and 36% of children with epilepsy can have elevated scores on screening tools for anxiety. It, again, minimally correlates with epilepsy variables and is more correlated with comorbid learning disorders, genetic predisposition, and psychosocial factors. And anxiety can be tricky because symptoms can be more of an inward manifestation and not as obvious. So often kids are not necessarily able to talk about anxiety, particularly in younger children who might feel nervous but don't necessarily have the vocabulary to say so. This is what makes screening so important. Next slide, please. A comprehensive approach to treatment tools for mood disorders in children should always be considered. And a general list to consider, you can see here, it would again include medications which are safe to use in kids, individual or family therapy, cognitive behavioral therapy, and relaxation training as well. Next slide, please. All right, so just to summarize, detecting comorbidities early is critical in kids. And key points to remember is that all children with epilepsy are at risk for comorbidities, and children with complicated epilepsy are at highest risk. So requests for screening and referral to a psychiatrist, a psychologist, a social worker, or counselor should be initiated early if there are any concerns whatsoever. And depression and anxiety in children are treatable. And we know that early detection and treatment will enhance neurocognitive outcomes and improve quality of life. Last slide, please. Finish up here, we'll just review what we've talked about. So depression and anxiety are relatively frequent psychiatric comorbidities. They can contribute to negative impacts on the management of epilepsy and the life of a person with epilepsy. And treatment options include both psychotherapy and medication. Pharmacotherapy, so medication, is generally helpful and well tolerated in both adults and children. And their adjunct supports are super important. So self-management programs and support groups can be a big help. Thanks so much.
Thank you so much for that informative and insightful presentation, Elaine. Truly fascinating. Thank you so much for the work that you do in this area. Our next speaker is Carol Lafleur. Carol is an amazing social worker with the Krembil Brain Institute's epilepsy program based at Toronto Western Hospital at UHN. In her role, Carol assists people living with epilepsy and their families through navigating services and mental health supports. She's also developed and coordinated a popular epilepsy education series to help those living with epilepsy have a better understanding about their medical condition. Carol, over to you.
Thank you so much, Heather, for that lovely introduction. Thank you, Verma, for sharing your experience living with epilepsy. And thank you, Elaine, for sharing that very informative presentation on epilepsy. I always learn a lot during these workshops, so thank you so much for sharing. Next slide, please. So good afternoon, everyone. Now I will talk about mental health supports, housing supports, financial supports, community supports, and education resources. Next slide, please. Okay, so how do I go about getting mental health support? So the first step would be to speak with your healthcare provider. That can be a doctor, nurse, social worker, or community worker. For most persons, that would most likely be your family doctor. So when you speak with your healthcare professional, they would make a referral on your behalf to speak with a mental health support person. Can be a psychiatrist, a psychologist, a psychotherapist, clinical social worker, or counselor who would do an assessment to see what your needs are and how best they can support you. Next slide, please. Okay, so who can offer mental health support? So mental health support can be offered through hospitals, community healthcare centers, epilepsy agencies, and private counseling agencies. These services can be offered in two ways. So you can access these services, which can be OHIP covered services or fee-based or paid mental health services. For the OHIP covered services, you would access these mainly through hospitals, community health centers, and epilepsy agencies. There's also a self-directed program called Bounce Back Ontario that I'll speak a little more in detail about that in the next slide. For the fee-based or paid services, sorry, can you go back to the previous slide? So for the fee-based or paid services, these can be accessed through a private counseling agency. If you have you're working and you have a private insurance, or you can pay also out of pocket, you can look for a private counseling agency who would be able to also offer mental health support. Thank you. Next slide, please. So, um, who can offer mental health support? So this is just a list of persons who can offer this service. I spoke a bit about that already, so we can move on to the next slide. Okay, so for more information, you can visit these links. So the CAMISH link, this is a very useful resource because they have a very detailed um, list of how you can go about accessing mental health support, who you speak with and what is done. So I feel like if you're looking or thinking about accessing mental health support, you can visit the this Camish link, and you will see very detailed information about what services are available and how you go about doing that. And Bounce Back Ontario, just to speak a little more about this. So this is self-directed, meaning that you can register on your own to this program. And what it is, you would have resources available to you through booklets and handouts. And there is also opportunity for you to have sessions with a counselor or healthcare provider who would guide you through this process. And there are also, I wouldn't speak too much about the other links, but these are also very useful resources if you're looking for more detailed information. Next slide, please. Okay, so how can I access affordable housing or subsidized housing? This is a very popular question that I always receive from patients. This is applications through, if you're living in Toronto, can be done through the access to housing. You go to their website and they do have, so there are a few ways you can actually access this. So you can either apply online or in person. So if you are thinking to apply online, you can do that, but in person, I would say could be more helpful because then you can have maybe a housing worker to assist you if you have questions. There are also facilities where you can use a computer at one of the locations to complete the application. Also, if you have special needs, or there's what's called supportive housing. So for people who are living with mental health or addiction issues, the application can be done through Access Point. If you have a disability, you can submit an application through Center for Independent Living. And if you have a developmental disability, this application can be done through the Developmental Services Ontario. Next slide, please. Okay, so for persons who live outside of Toronto, um, the application is done through the Ontario Non-for-Profit Housing Association. They have a list of locations, so different regions, depending on what region you live in. There's contact information and the website for where you have to submit your application. A very useful resource that I always point uh, persons to is the Housing Help Center. So if you register through the Housing Help Center, the website is available, highlighted here. They do have housing workers who can actually assist you with completing your application. They can inform you or update you on apartments that become available. If you're looking for a certain type of housing, maybe you're looking for a particular area. If there's apartments available in that area, they might be able to give you the heads up that that's available. So I would say that this is a very useful resource. And if you are not sure how to go about applying for housing or you have specific questions, this would be a center to register for, so that they can assist you to navigate the services. Next slide, please. How do I receive financial support if I am not working or working fewer hours? So there are a few funding options. So these programs are through the Ontario and the Canadian government. There is an eligibility criteria, but mainly what these supports would do is help you with your basic needs, so medication or food, also with shelter, so helping you to pay for your rent. So the eligibility criteria for this mainly is if your income is of a certain level, and they look also to see if you have investments like RRSP, TFSA, or if you have inheritance and so on. Depending on how much it is, you may or may not be eligible. So it's not everyone can apply for this. Only if you're below a certain income level that you can apply for this funding. Next slide, please. Okay, so a few funding options here. So there is the Ontario Disability Support Program, more better known as ODSP, Ontario Works, Trillium Drug Program, Canada Pension Plan, or Canada Disability Pension Plan. So ODSP, most persons who are eligible would apply for this funding. And once you apply for the funding, what happens is that it's two parts to the application process. So one part, person living with epilepsy who's interested in applying, you would have to complete one part. Then you would take the second part, which a medical practitioner would complete, and then you would submit the package, and they would assess to see if you meet the requirements to access this funding. And Ontario Works is that's a little simpler. So you would complete the funding or get assistance for help to complete the form. So you can contact them if you need help, and they would have someone assist you to complete the form. So you would call in and um, request help if you are not able to complete it on your own. The Trillium Drug Program, it's only specific for medication. So if your medication costs are really high and you're finding difficulty paying for it and you're not eligible for ODSP or Ontario Works, you can apply for the Trillium Drug Program. The Canada Pension Plan, or Canada Disability Pension Plan, that's also a funding you might be eligible for, but this would they would give you a flat amount. So, example, $500 or whatever they assess the need to be, but that is not really allocated for medication or housing or anything like that. That's just support for you. But for more information, please visit the websites. Click on the links or visit the website just to get some more detailed information. I'm also happy to address any questions about any of these fundings after this presentation. Next slide, please. Okay, so how do I get in-home or community support? So for some persons living with epilepsy, you might be looking for um, support within the home. So whether it's physiotherapy, occupational therapy, worker to come into the home to assist with, the care, whether it's bathing, which I'll speak with in the next slide. But generally, you would speak with your healthcare professional and state to them whatever your needs are, and they would make a referral on your behalf. Or you can also call on your own and state your needs, and they would generally what happens is that they would call you after the referral is sent, and do an assessment over the phone. Once that assessment is done, then someone would come into the home to, to see what your home situation is and to see if you would be eligible to receive this type of support. Next slide, please. Okay, so some of the things, some of the services that you can receive through the Home and Community Support Services, formerly LIN or CCAC, would be personal care. So that would be bathing, if you want, help bathing, or toileting, feeding, or they also do home care, laundry, or house cleaning. These are just some of the services. Also, for some persons living with epilepsy, you might have, difficulty walking, or you might have difficulty, with safety issues in the home. And so you can have like an occupational therapist who would come in and do an assessment to see, the safety of the home, educate you on how you can be safe in the home. They might also provide, to make suggestions of things that you can do in the home for safety. Physiotherapists would come into the home to do exercises, mobility, address mobility issues and things like that. But all of these services you would have to be assessed for and deemed eligible for. These are all OHIP covered services and time limited. So these services are not, long term, they're more short term services. And for additional information, you can visit the website to get more information on this. Next slide, please. Okay, so last but not least, education resources. So the more education you get is always better for you. And so there are a few websites that I've listed. I'm going to highlight the first one through Toronto Western Hospital, Epilepsy Education Series. So these workshops, which I coordinated last year, are workshops on various topics. So for instance, if you wanted more information on ODSP, there's a workshop for that. If you wanted more information about managing your medication or understanding more about medication, there are workshops for that. So I would highly recommend it, that you visit this website if you're looking for more information about epilepsy, or if you're a caregiver and you're looking to learn more about epilepsy, you can visit this website also. Also very useful is Epilepsy Ontario website. They have a list of you know additional resources for epilepsy. If you're looking for maybe a popular question that I get is persons are looking for maybe a therapy dog or something. They would have they have an agency that would you can access this service through, and you just have to submit an application. Also epilepsy agencies. So a lot of persons are looking for support within their areas. So counseling support, meeting other persons with epilepsy, such like. And so an epilepsy agency is a very good place to start where you can access support. And so I would suggest that if that's something you're interested in, you can visit the website, and then there are a lot of epilepsy agencies within the Ontario area. So please feel free to look into this and to receive as much information as you can. Um, and thank you. That's it. Thank you all for listening.
Thank you so much, Carol. Thanks for presenting today, and that was such great information. And thank you for the work that you do with patients and their families too. We're now going to turn to the Q&A portion of our event, and we have a lot of questions, so thank you so much for writing in. A quick reminder that if you'd like to post a question, you can do it in the chat box on the right-hand side of your screen. You can DM us on Twitter at Ontario Brain, or you can email us at communications@braininstitute.ca. Okay, so I'm going to send the first question over to you, Elaine. And the first question is, why don't we call depression and epilepsy the same disease affecting different parts of the brain, since they seem to have similar mechanisms? Elaine?
All right. So let me see if I understand the question. So I think what you're referencing with your question is that something we all know, that the brain is both dynamic and complex. And so the relationship between epilepsy and depression can involve similar areas of the brain and networks that are involved, or it may be that there's some connectivity between networks that lead to a person having both. Oftentimes, as I mentioned, depression can sometimes arise from areas of the brain where seizures also have their onset, and we know specifically those areas of the brain are also related to mood. But sometimes that's not the case. You'll remember I talked about many different things can contribute to a person experiencing depression. So it can be neurobiologic, it can be environmental, it can be genetic, and it can be psychological. So there can be many different sort of aspects that we need to consider when we think about epilepsy and depression. But that's a really great question. I wish it were simpler and we could always say A is linked to B and we end up with C, but that's just not the case. And I think because of that, and because of all the different factors that are in play, that's another reason that when we think about treatment for depression, it's very individual. And so getting the individual attention you need around these problems is so important, as well as billowing them with support from your community. I hope that helps.
Thank you. Thanks, Elaine. We have a question for Carol now. Considering the impact of PTSD and injury that can lead to epilepsy and seizures, can Veterans Affairs Canada provide mental health support for people living with epilepsy? Carol?
Okay, thank you for that question. I have to say I'm not familiar too much with. I can speak to PTSD, but I'm not sure about I'm guessing the question is if Canada's Veteran Association can provide mental health support. Was that the question?
I think so. Yeah.
Unfortunately, I wouldn't be able to say. I can look into that and provide an answer at a later date, but right now I'm not sure about that. So sorry about that.
That's no problem. Thank you, Carol. We have a question as well from Jamie, who did write in to let us know that she has been seizure-free for 20 years, and she's recently had a breakthrough seizure. And so the question really is, how do breakthrough seizures affect a person's anxiety level? And if someone's been seizure-free but experiences a breakthrough seizure or a stressful situation, how can they manage that? So why don't I throw that back over to you, Carol?
Sorry, could you repeat the question for me? I was looking
Sure. So
I was looking to get
that's
information for
okay.
the last question. Sorry about
It's
that.
really about, no problem, Carol. It's breakthrough seizure. So somebody's been seizure-free
Mhm.
for quite a long time. And then they have a seizure in this case, for example, Jamie was the one who had written in the chat to let us know. So, how do they manage, how does somebody with epilepsy deal with, the anxiety and the fear really, which is, I guess, Elaine, what you touched on earlier, of these events happening or the fear of them happening? What are some tips and management things that you can suggest to help someone deal with that? Elaine, do you want to take this one?
Sure. I think, starting with communicating with your provider about what you're feeling. Being seizure-free for 20 years and then, having a breakthrough seizure come can be very, very difficult. It's like you have to start over. And I think I'm going to ask Verma to comment here too, because her lived experience is something we can all learn from, and her feelings in adjusting with having a breakthrough seizure. But what I would say is begin with communicating your feelings to your provider, to your loved ones, your family members who are close. Express the fact that you are feeling fearful about the unpredictability of your seizures. And then hopefully you'll get connected to the right supports to make sure that you can get help to work through that. And Heather, is it okay to toss it to Verma, because I think she may
Of
have some
course.
valuable insight for listeners. Yeah.
Verma?
Hi. So, while I haven't been seizure free for a very long time, I did have the experience of having a breakthrough seizure while on meds, and it really sent me spiraling because the effect was that this is never going to end. There's no way to sort it out. And I agree with Dr. Elaine, is that to really let your neurologist know right away, and there might be some tweaking that might be available. Also, one of the things I work on is trying not to be stressed, but then in trying not to be stressed, you get stressed and you're anxious and you're depressed more. But really, for me, it was helpful to look out for my supports again, and to speak with my family, my sister, my best friends, my partner, and really not to lose hope. There was someone in my group who had a breakthrough seizure after 6 years of being seizure free, and again, we were able to talk about similar emotions and feeling as if you are starting from the beginning, and managing the mental impact of that is something I think is also key. And that's so far what I've been able to experience myself and with peers.
Verma, what's the
Yep.
biggest challenge that you've experienced in terms of managing your epilepsy and your depression?
The biggest challenge is that it's a spiral. It's a circle rather, and that it's after each seizure, I know I feel worse. And also the biggest challenge is that sense of worthlessness, that sense of why am I here? Should I go? It's My life is so different now that it's hard to get beyond what it used to be. And also that lack of independence and the anxiety that comes with it, and the lack of focus with, my sister and I talk about me squirreling, where it's hard to pay attention to one thing and then move to the other. And then that also makes me more depressed because I feel less than normal. That's the challenge. And of course the fear of having a seizure in an uncompromising place, a place where I'm worried that I will be able to get the support, like in an Uber or on the subway. And also disclosing to friends, disclosing to some family members or people that I come into contact with. And one of the things that I do to help is, I don't know if you can see this, I wear a medical alert bracelet where, should I fall into difficulty, there's a number that can be called, which provides all my history and meds and so on, which is also very important for emergency services. So there are myriad issues, and it just makes life more challenging in general, and harder to find hope in this situation.
Thank you, Verma. Thanks for sharing. We do have one more question. Elaine, this one's for you. And this question is about medications. I apologize if I'm mispronouncing, which I probably am. Brivilera, I believe, Brivaracetam, and Keppra. What do we know about their side effects in terms of mental health? Elaine?
Right. And so I'm going to speak very generally. Yep. Can you hear me? Okay. I'm going to
Yes.
speak very generally about specific medications. And that's because of something I shared with you early, that as I was giving you information, that every person is different. Their response to a seizure medicine or to an antidepressant may be different. There are certainly some medications that trend towards having more side effects around depression and anxiety, but we can't say that for each person. And so advice here is, if you're on a medicine and you're experiencing new symptoms of anxiety or depression, communicate those to your provider, whether that be one of the newer medicines or an older medicine. Don't suffer silently. It's so important. You know, anti-seizure medicines all come with a warning about the possibility of mood changes. And so, you know, your provider is very used to hearing about this and to pivoting and helping to look for solutions, whether that be a dose change or a medication change or a formulation change. Those are all possibilities to bring help. You know, without speaking to any one medicine, that general concept of some medicines for some people bring
Oh, it looks like
Oh, I
we
think Elaine
may have
left.
lost Elaine. Yeah.
Um,
Okay, well,
could I add?
you've oh,
adverse
sorry, Carol.
effects related
Did you
to
want to
mental.
add?
No,
Sorry, Elaine, you cut
I
out
was gonna say,
again for just a moment, but Carol, why don't you add quickly?
okay, no, what I want is I wanted to add to what Verma said. So she did show the bracelet, the safety bracelet. So I was gonna also say that in addition to that, what I normally advise patients that I work with is to also register with the police. There's police
Mm, yep.
vulnerable persons registry. So just in case, the reason for doing that is just in case if they get a seizure, some patients do get like aggressive or their behavior is strange and the police might not recognize and see it as, something, charge them for it. And so if they have the registry, if they're registered, they would be able to see a history of, okay, they have epilepsy. These are some of the presentations. And so they might be able to avoid an arrest. Because I don't know if you noticed on the news recently, there was a patient who was arrested. He had epilepsy and the police arrested him because he aggressed towards them. And they, of course, didn't know he had epilepsy. And so he was charged. So that's another thing I feel for patients. If they can register with the police registry, it would be helpful.
That's a great point. Okay, well, on behalf of CAN-BIND, EpLink, and the Ontario Brain Institute, I would like to thank all of our speakers for presenting today. You were all wonderful. And a special thanks too to everybody who was watching and to those of you who submitted questions. We hope you enjoyed the event and we hope you found it helpful. We do have a few resources to share with you with more information around this topic and supports available in Ontario. So we're going to post them on the screen shortly. And they're also going to be on the Ontario Brain Institute website, which is braininstitute.ca. We're also pleased to announce the launch of a special report on epilepsy, depression, and anxiety that provides more information about some of the topics that you've heard today. And that report is also going to be available on the OBI website. And finally, your feedback is super important and valuable to us. So you will notice a survey link in the chat box, and we would so appreciate you taking the time to share your thoughts and about today's talk. So thank you so much for joining us and have a great day.